Hello, this is Jonathan Davis from PtEverywhere, and I'm joined today with the founder of Go CardConnect, Tom Cooley. Tom, thank you for joining us. We're both in our home offices today amid the coronavirus outbreak, and obviously this is having an impact on a lot of things, how we work and what we're doing. How's this impacting things in your world?
Jonathan, thanks for having me. I really appreciate it. Looking forward to chatting today. What's really interesting, what I'm seeing is I've been extremely busy. There's countless merchants, existing and prospects, are reaching out to basically evaluate their merchant processing fees. They want to know that they're getting a good deal. They're also looking at their technology. So they want to implement things like secure card on file or other type of payment functions that are offered through the CardPoint platform. Really, what's the most interesting is what I'm finding is people are just evaluating their overall process, right, of how their practice is operating, how it's working, and they're looking at everything, and they want to look at everything from a holistic perspective and streamline things and make their life easier, which is a great time when there's a pause, right? When we're all kind of in this pause environment. Right? So it's a great opportunity to take a deep dive and take a look at some of those solutions that they didn't have time for in the past. So we're seeing a lot of people evaluate their technology. So that, I guess, leads me to a question for you. Are you seeing a lot of new inquiries for PtEverywhere?
Yeah, Tom, it's interesting because a lot of people view PtEverywhere as a scheduling system, as an EMR system, and in fact, we were recently named the top-rated EMR among other physical therapy EMR systems when you talk about electronic medical records. Now, specifically in this time, what we're getting a huge demand for is telehealth and remote programming. So therapists are still able to provide education, provide instruction, guidance through a video chat or through home exercise programs. So it's nice to still be able to help your patients, even though you can't see them face to face. There's a patient portal, so patients can fill out paperwork, they can view receipts, they can also view their home exercise programs and schedule appointments.
Fantastic.
One other thing, obviously, that's important is payments. So you can collect payments through CardConnect. And I want to talk about that. Can you tell us a little bit about what's new in the integrated payments world?
I just wanted to back up a little bit in regards to the features you're talking about. So basically, what you're saying is PtEverywhere is perfectly suited at this point for any type of telehealth or type of stay-at-home physical therapy procedures. So practices are able to help their patients without a hiccup.
Exactly. Yeah. So, therapists are able to demonstrate exercises. They're able to, hear the patient's concerns and provide guidance that way and education as well.
Okay. Excellent. So before the time of Corona, was the telehealth a component of PtEverywhere? Was it one of the flagship features of the product, or was it more a nice to have?
Yeah, that's a great question. There's a lot of new telehealth software that's popping up, kind of as a response to the coronavirus outbreak. We've been doing this for a while. We have a great grasp of what's needed and what physical therapists need as far as a telehealth platform goes, and an all-in-one telehealth platform as well. So now just the demand greater. So we have many more users. We have many new users as well that are welcome to the PtEverywhere family largely because of telehealth.
That's fantastic. So PtEverywhere is perfectly positioned to be able to respond to this crisis by helping their customers with a product that makes basically seamlessly provide care for their patients.
Exactly. And what we've seen up until the last few months is we have some clinics where they're seeing patients face to face. They would do a few telehealth visits, whether it's an introductory discovery call or just trying to get an idea or present their services to a new patient. We'd see that pretty often. But now at this point, most clinics are exclusively telehealth. And we're happy that we're able to provide a platform that provides that solution for them.
Fantastic. Excellent. Yeah, that's exciting times. I'm happy to be partnered with PtEverywhere. Especially offering such a great product in this time that it seems to be pretty high demand.
Absolutely. So yeah, so we chose CardConnect as our partner, and I know you were in that conversation. And can you talk a little bit about why that decision was made? What things about CardConnect are different from the other alternatives that are out there for payment processing?
Well, the great question. So I remember those conversations early on, and they're really, I like to break things down into kind of simple buckets. So there are really kind of three distinct value propositions that we could offer that nobody else really could offer. So the first one was this integrated payment technology and the level of security that's built into it. So the CardPoint platform, which is the platform that processes all the payments through PtEverywhere, instantly encrypts and tokenizes the card data at the hardware level. So nowhere within your environment, within PtEverywhere or CardPoint or your local environment, your computer or your phone or tablet or anywhere, do you ever have credit card data. All you have is encryption and tokenization happening. You see a tokenized number, but that's not the credit card number. With that, the ability to store that credit card data, that empowers the practice to really take charge of their payments function by either storing that card on file to charge if the patient, on a recurring basis, if the patient doesn't show up, or just to kind of streamline office procedures and automatic check-in, just go ahead and charge the card as opposed to, having the patient get out and swipe their card and transact. So being able to store that card also gives the ability to build payment plans and, so empowers the practice to really take charge of the payment function. Another major component was really our ability to relate with the physical therapy community. Go CardConnect is a sales office for CardConnect. It's wholly owned by myself, and we focus exclusively in the physical therapy community. So we don't talk to any other merchants other than physical therapists. So when we're working with software vendors that we want to partner with, we have a lot of value in having a synergistic approach to talking to the same client. And I think lastly was really the ease of how everything came together. I know the integration was pretty quick and easy process. I know that setup and support for each merchant, it's just streamlined from a merchant's level. They're seeing something that's truly integrated from a PtEverywhere perspective. They don't understand who CardConnect is a lot of times because it just happens, everything happens on the back end. So it's a truly integrated solution, seamless, and everything works perfectly. So there's, I would say those are kind of the few reasons. I'd like to think that I had something to do with it, but I'm just joking.
Well, and I'll tell you, it's getting even easier. You talk about ease of use. Yeah. And one thing in particular, I actually have this right here, is the VP3300. So this
Fantastic.
is a Bluetooth device that you can connect to your PtEverywhere app and swipe payments. Yeah, we have a lot of customers that are excited to use that. It's $99, and you connect it to your phone or iPad and process payments by swiping that way.
Yeah, those are phenomenal devices. Those have been flying off the shelves. One of the things I wanted to point out about the new devices, if you want to just hold it up because I don't have it there. So one of the things about the new devices is they're frictionless from the front desk perspective. Basically, in this time of Corona, that's an important feature because the cardholder, the patient's not handing the credit card to your front desk who's swiping the credit card, handing it back, right? They're simply saying it's ready now. The customer dips their chip or swipes their credit card, and they never let go of their credit card themselves, or they never hand it over to the practice. So, I think that we're going to see more and more small changes in our life that are going to continue to evolve into more of a contactless environment. But this is just one example.
Another example would be, in the PtEverywhere app, the patient can log into their portal, same place where they can fill out intake forms, where they can schedule appointments, they can view their home exercise videos, They can make payments. They can add payment information. So whether it's a credit card, debit card, HSA, or FSA card, patients are able to add that information without ever having to hand the card over and get that card back from the therapist.
Cool. So there was one thing I wanted to just bring up that I'm hearing a lot of recently, and it's in regards to PCI compliance. PCI compliance, PCI stands for the payment card industry. So it's an established set of rules that both merchants and merchants, meaning private practices, and credit card processing companies have to abide by if they're going to transact with Visa and MasterCard. So all of the products and services through the CardPoint platform, 100%, are PCI compliant out of the box. That includes PtEverywhere. So the way that our integration works with PtEverywhere, the entire operating environment is fully PCI compliant. What the PCI compliant mandate is for the merchant or for the private practice is they simply validate that their environment is safe and secure as well. So when they're logging into your application and our application to process transactions, we don't know where they're coming from. So the PCI validation process is simply a set of questions that the merchant answers, the private practice answers, that just says that they're operating their environment in a secure format. Within PtEverywhere, aligned with CardPoint, we actually provide you access to the PCI dashboard, which allows you to validate your PCI compliance on your own time.
Right.
But it's free of charge. It's included with the application, the free PCI tool. So if you have not already done so, you should definitely log into CardPoint. Look under My Account. You'll see PCI Compliance, and you can follow the link to validate your compliance at that point.
Exactly, and when we have customers that they get maybe frustrated by PCI compliance or HIPAA, but the alternative is a breach of protected health information or a breach of your patient's card data. So PtEverywhere and CardConnect are providing these free resources and a secure environment where you are both PCI compliant and HIPAA compliant, which obviously are fundamental to having a physical therapy software where you're accepting payments and storing patient information. So I'm glad we're able to catch up today and talk a little bit about the new BP 3300 and talk about the state of physical therapy software and telehealth. But yeah, we'll do this again soon. So I appreciate you taking the time today to catch up, Tom.